Making It Last, where we share ideas to help families tackle major issues. I'm your host, Regina DeMeo, and with me today is Andrea Leiman, who has been working with families for over 35 years, helping kids in the Montgomery County area. Thanks so much for being here.
My pleasure. Thanks for having me.
Absolutely. So, what is the most common thing that you see that children struggle with in this area?
Well, there's a wide spectrum of problems that kids come to my office with, ranging from family problems, divorce and separation, to behavioral problems, especially behavioral problems in school, sometimes related to learning disabilities, to children who have actually severe emotional disorders that start to be noticed when they're young.
Okay. I find it interesting, some people don't understand the difference between anxiety and depression. Can you distinguish that for us?
Sometimes it's pretty clear, one versus the other, and other times they're not mutually exclusive, and you can see the same in one child, see both, just like with adults. Anxiety tends to be, though, more energized, that you see children who are busier, who may be losing focus, who have more behavior problems sometimes, or who will focus on things that are bothering them. And with depressed kids, they tend to be what you might expect, more sad, more withdrawn, less involved. You start seeing them pulling back socially, and they're quieter about their issues often than children who are anxious.
Okay. So what are some of the warning signs that parents should be looking for?
There are two continua that I tell parents to be aware of. One is what I call the dysfunctionality of a problem, that, how much is what they're demonstrating having a negative impact on their functioning. Is it affecting their social life? Is it affecting their school performance? Is it affecting their getting along with family members, their ability to engage in outside school activities? That's the first criterion, which is to say, is whatever the problem is beginning to have that impact. So, for example, a child may have some sleep disorder, but if it's just, they're waking up in the middle of the night a couple of times with nightmares, that may not be enough to impact their behavior. Okay. But if it's serious enough and they're not getting enough sleep and it's really becoming, clearly disturbing to them, that's one criterion.
Okay.
The other is what I call the chronicity. How long is the behavior going on? And using sleeping as an example, all children have nightmares sometimes. All children go through stressful periods, especially, for example, before school starts. You may find that children have worries and anxiety before the next school year, and that may turn out that they end up having sleep problems. They wake up in the middle of the night having nightmares, or they're having trouble falling asleep. But I would tell parents who don't immediately need to rush out and see a mental health provider, because it may be transient and it's just situational, as opposed to, is this now becoming more chronic, that, every night or several times a week, past when you think this is a reaction to something in particular, the child is continuing to demonstrate a behavioral problem or a concern that parents are picking up on, then I'd say, you really maybe need to talk to somebody. So it's those two dimensions, how much is it impacting the child's ability to function in their normal world, and how long is the behavior going on? Is it really becoming more of a pattern rather than just a transient, episodic event that's happening?
Okay, no, that makes sense. So when you're dealing with the children, are the parents in the room, or do you keep the parents? I just want to make sure that we all have the appropriate expectations.
Sure. Most child therapists see children individually without the parents present. And in fact, when I work with kids, what I find is extremely important is that they're given the concept of privacy and confidentiality in their work with me, meaning that they're free to tell anybody they want about what happens in my office, but that I won't share it directly with parents, siblings, teachers without their permission. And that is kind of a crucial piece, even for very young children, which seems amazing, but it's actually quite true that children really want to have the sense of control about what they share is going to be shared with whom. And so parents know that before I start working with their children, that I do give their children that sense of privacy. There are certain exceptions to that, obviously, that if I hear about any child abuse or suicidality or harming themselves or others, I tell kids as well as the parents that I will have to notify families in that event.
Okay.
But otherwise, I ask children ahead of time, and I may say, I think your mom and dad may need to know about this issue, and we'll talk through how we'll tell the parents.
Okay.
So most sessions tend to be just me with one child. However, I do also see families together, and sometimes I do suggest that children meet with their parents if there's a particular issue that they want to work through, and that I think it would be helpful for the parents to hear their child's perspective directly. So I tend to be flexible in when it's appropriate to have parents in and when it's just me and the child, so that we can determine what are the issues that really parents need to be very keenly aware of and involved in making some perhaps alterations in the family system.
So what do you do when a parent is asking you for updates, right? Because I imagine some people are like, well, I'm paying for this. Like, what is it that I'm getting out of this, and how long is this going to go on for?
Absolutely. And again, at the beginning of working with a family and with the child specifically in a family, I tell parents that I do meet with them on some kind of regular basis, and it depends on how troubled the family system might be or how serious the behavioral issues might be, perhaps where the parents clearly need to be involved in helping the child organize themselves and be able to calm themselves down sometimes, those situations. So sometimes I meet parents every couple of weeks, sometimes every 1 month or two. And I tell children this also, that I will be meeting with your parents and we will be discussing how things are going. And it's really a two-way street because it gives me a chance for parents to update me about what really is going on. Is the child improving? Are there still concerns? What are those concerns? How can I help the parents manage situations that arise at home? And it also is to give parents some feedback. But again, I tell children that I'm not going to share, which I don't, directly what they've told me. So it would be more, your child is still concerned or is showing signs of anxiety, and we'll talk more in generalities because the focus really is on how the parent can help the child move forward with whatever issues they're bringing into the sessions.
So at what point do you decide, or how can you make a determination that the child will just benefit from, talk therapy, right, versus actually needing medication? Like, where do you start to figure that out?
Well, I always prefer that children start in therapy and not have to go to medication because they're such little children, and all these medications have some potential long-term impact.
Right.
And even young children who are not particularly articulate yet can benefit from play therapy. Children as young as 3 or 4 can still utilize the type of play therapy that I and other professionals do, which doesn't require sitting, talking directly face to face, that you engage them in play and other activities, games, drawings, crafts, those kinds of activities that engage their hands often and also engage their imagination, via which they convey some of their concerns and things that are troubling them. And I usually only recommend that they get a consultation because I can't prescribe medication as a psychologist, but I can suggest that they may want to consult with a physician, preferably a child psychiatrist, who knows about medications for particular problems. If it really feels that, again, going back to the notion of dysfunctionality, if it's really continuing to have a negative impact on their ability to function, and therapy is not able to address it. And there are some things like obsessive-compulsive disorder that often respond quite well to psychotherapy, but after a period of time, if it's still so intrusive that children can't get out of the house in the morning because they're still engaged in rituals or staying up late at night and not getting enough sleep, and if we can't work to develop strategies over time, then it may be worthwhile in that kind of a situation, or children with severe behavioral disorders who can't regulate themselves, that you may get to a situation where you'd say, it might be a good idea to consult with a physician.
But these children that may need, I mean, there are people that just have a chemical imbalance and they might need this medicine, but they should still be seeing a therapist on a regular basis to try and make sure that everything is going okay.
Right. Well, and I feel very strongly about that issue because sometimes families do that they just say, well, I'll put my child on medication and then I don't need the child to be in psychotherapy. And I think that's really problematic.
I was going to ask whether, it would seem some people would say, oh, well, I'll just cross it off the list.
Just take a pill and you'll be okay.
Right.
And, as I said, I feel quite strongly and passionately about that, especially children, but adults as well, really need to be followed by a psychotherapist. Because even if you're on a medication, say for attention deficit hyperactivity disorder, it's really important that children learn to manage themselves and take some ownership of the problems, because the pill isn't a cure-all. Right. And they need to feel that they have some empowerment and control over their own behavior. So even if the medication helps children, whether, again, it's with obsessive-compulsive disorder or behavioral dysregulation, ADHD, that it's still important that what psychotherapy can do is help them feel empowered and that they do have some ability to strategize and manage themselves, not just because they're taking this little pill.
So how early could a child start seeing a counselor?
As I said, they're very young children. Even I usually see children as young, no younger than 3 to 4,
okay.
But they're very young kids that are seen because, again, they're able to engage in play therapy, and that it can become very both cathartic as well as helpful in understanding what some of their struggles are and maybe their conflicts and some of their anxieties, because they play it out in the playroom with a psychotherapist. And it's also helpful then to work with the parents with children that young to help them understand what are the issues that their child may be struggling with. Again, it may be behavioral dysregulation, it may be OCD even at that young age, that you start seeing anxiety pieces come through.
What do you see most when there's a divorce situation that the children struggle with?
Mm-hmm. Well, I think there's usually a great deal of anxiety about what does this mean for me. Children tend to be very egocentric, and their questions are always about, okay, you guys are splitting up, but how is this going to affect me? Mm-hmm. And the most important job for parents with their children is to help focus on what the children's needs are and what they're anxious about. Things, whether it's, will I be able to stay in my same school? Will I stay in my house? What will happen to my favorite stuffed animals? What is this going to look like for me? And, children can become very anxious about those situations.
Sure.
They also can become angry because they're feeling bad and sad, and anger is the easier reaction. Children and adults as well tend to become angry instead of sad sometimes. It's easier to manifest being frustrated and upset via anger and outbursts, and so those are kinds of markers that parents can look for.
So how can parents sort of minimize the stress during a divorce? Do you work with parents, maybe sometimes, as I think you do some parenting plans with people?
Yes, I do.
So how does that work?
Well, whether I'm in my role as a psychotherapist with children and families who are getting divorced, or sometimes in my role as helping parents create a parenting plan as they go through their separation, I always tell them my focus is on your children and what are their needs, and what do you both need to do. You're the grown-ups to help your child transition through this period in as positive a way as possible. And, one of the things that parents tend to do, because we love our children, is to try and protect them from anything bad and to try and minimize the negativity. And it's often a trap for parents, because when you try and say, oh, everything's going to be okay, it really isn't. Parents are trying to say, in the end, you'll be fine, and that may be accurate. But where a child is at that point, they're going to look at their parent and go, no, it's not okay. You've kind of turned my world upside down. So I always tell parents it's okay to be empathic, and in fact it's very important to be empathic and to acknowledge where their child or children are, And to say things like, I know this is really hard for you, or I know this is making you feel sad, or you're worried, or you're scared, or whatever the emotion is that you may see your child experiencing. And then you can say, but we're going to work on this together, and we're going to all move forward, and we're going to try our best to minimize some of the negativity. But it's not helpful to kids to minimize their perception of reality. I often give parents the example, if your child says, I'm afraid there's a monster in my closet, the first reaction is parents to say, oh no, don't worry, there's no monster in the closet.
Right.
And children go, you may think there's no monster in the closet, but I know there's a monster in my closet. So that
that's their reality.
Yeah.
That's their reality.
And so the strategy is sometimes to say to children, okay, let's look in the closet. I don't think there's anything there, and this is how you can feel safe. And it's not to say that what their reality is real, but it's not to immediately deny their perception. And that happens with fear, physical pain, as well as emotional pain that children are experiencing.
So, it sounds like what you're saying is we don't want to, as parents, dismiss their concerns and just make it seem like pass judgment, basically. Like, you're wrong. There is no monster. Right? The goal is to... Right.
And it comes from a place with parents if they want to make it okay and they don't want their child to be upset and to feel bad. But the reality, especially going back to your question about kids whose parents are separating and divorced, of course they're going to feel bad. You'd be concerned if they didn't feel bad about it. And so it's important to acknowledge the bad feelings and to help children move forward and be able to come up with ideas to make themselves feel better, and for parents to be in charge and say, we're going to work on this so that it is going to be okay in the end, but I understand right now you're pretty upset or pretty angry or frustrated or whatever, again, the emotion is that you sense your child is experiencing, or they tell you directly that they're experiencing. Right.
So I'm sure you see this a lot. I do too. Like, especially with divorced parents, a lot of times there's two very different parenting styles. And there might be one who is much more empathetic and one that just may not have the best parenting skills, or it's just different.
Right.
So how do you sort of help people in the divorce situation deal with those differences?
Well, I try to encourage parents to be co-parents and to try and do things in similar manners. But I understand that they're two different people, and whether they stayed married or separated, children would experience their parents as being two different people with two different attitudes about rules and privileges and using screen time and a whole host of other situations that crop up. And really the difference is in families where parents are together, children can see by parents modeling, we may not always agree, but we can kind of work through it and come up with a compromise, or we mutually agree to some decision.
Right.
When parents are separated and they're two separate homes, it does become very glaring that, one parent says you have to go to bed at 10 and one parent says you can go to bed at midnight.
Right.
What do I do? And, I talk to parents very directly about there's some rules that, kids will be okay adjusting, that one house they use one kind of toothpaste and another they use a different one.
Right.
And, kids are very adaptable and flexible most of the time and can learn to accept that. But there may be other rules that really do need to be consistent.
Right.
And it's preferable if parents can work together to make some consistent expectations of children, whether it's about school or behavior or kind of the bigger issues. But children do tend to learn that, when I'm with mom, this is what I can expect, and when I'm with dad, this is what I can expect. And the goal is really for parents not to keep fighting it out and put their children in the middle by saying, my way is right. No, my way is right. That often it's just, okay, you can both do what you want, but your children need to be able to be free to do, mom's way at mom's house and dad's way at dad's house.
Makes sense. We're going to take a short break, and then we will be right back.
DeMeo's.gov.
Welcome back to Making It Last, where we share ideas to help families tackle major issues. I'm your host, Regina DeMeo, and with me today is Dr. Leiman. Thanks so much for being here.
Again, thanks for having me.
So, after the divorce, which is what I have to deal with most of the time, I'm sure I don't see this part, but I'm sure you do. Families, transition, and next thing you know, someone's getting remarried, and now there's a blended family situation. Do you see a lot of blended families coming to you?
Yes. Although a lot of times I see children at the beginning before there are kind of step-parents and blended families involved, and sometimes I help kids go through that transition, or parents are anticipating that those are going to be difficult transitions for kids.
So why is it so difficult? Is it the same sort of thing? There's anxiety about something new, something different?
Well, I think there are so many factors involved when a parent remarries from children's perspective. The one most glaring is that almost every child harbors a fantasy that their parents are going to get back together. And, I've even worked with 20-year-old people who have said, I still think that, my parents have been divorced for 20 years, and I still think they're going to get back together.
Okay.
So when parents announce that they're actually going to get remarried, it kind of is the most clear-cut notion that that's not going to happen.
Right.
And so kids tend to revisit almost that sense of loss, that their parents are not together and that they're moving on. And some children tolerate that better than others, but there are a lot of children, including teenagers and young adults, who have a very hard time accepting that their parents are moving on and that they're never going to get back together. The other piece often involves other issues related to loss, because that tends to be the theme that you hear about. The loss of sometimes the family home, that often at that point parents move on and move to a different place. Or the fact that somebody else moves into their home and their sense of it being their space feels trespassed upon, that somebody else, another parent and siblings potentially, are all moving into their space. And sometimes kids really resent that this is my house and who are you to be sleeping in a bedroom, and what used to be maybe my bedroom, or I'm sharing a bedroom. There are lots of issues of kind of privacy and
territorial wars.
Right, absolutely. And subtle things about who's mom or dad's favorite. Are you going to like them more than you like me? Am I still going to get attention just from mom or dad? What is the role these other children and this other adult going to play in my life? Again, the older the children, often the more resistant they are. That
Really?
Yes, and teenagers tend to have a very hard time with I have a mom or dad. I don't need another mom or dad. Why are you kind of entering the picture? So there can be a lot of challenges, and it really needs to be thought through carefully. And it's also helpful to elicit from children directly, again, what would make things easier for them. It doesn't mean at all that you're giving them the decision-making authority, but you're respecting that, whether it's what color do you want to paint your new room, where do you want to put your belongings, how do you want to transition in certain ways, that can be helpful. And parents, again, aren't required to do what their children request, but you are acknowledging that they have a viewpoint, and that sometimes it's actually quite easy to address their concerns. I'm afraid you won't read me a story before bed anymore.
Right.
Oh, of course I will. And then you can alleviate their anxiety pretty quickly.
Or one-on-one time.
Right.
I think that's a big concern.
Absolutely.
What about, have you seen a lot of step-sibling rivalries? Does that happen?
It absolutely can happen, and it's sometimes hard to predict, because sometimes there are children who have siblings that they've always wanted. I have the brother I never had, or the sister I never had, and bonding can be very positive, and that can be a real plus to helping the blended family move forward. But then sometimes it turns into competition, especially if two siblings happen to be very close in age or going to the same school. And, you just have to be aware of it. And again, a lot of it is just talking and acknowledging that it's not easy. That, it's not just, we're all going to, now live together happily ever after. That you really have to work through and discuss and allow children to express their frustration and even express that they're not happy. Often, going back to what we were talking about earlier, parents don't want to hear that their children are unhappy or struggling. Right. And especially if
because they're caught in their happy moment. It's
right.
like, I'm happy, you should be happy for me.
Exactly,
Right?
and this is great, and we're all going to be this great happy family, and then their child says, not the case. I'm really not happy. And parents need to tolerate that and say, I hear you that for me it's really a happy time, and I understand for you that you're anxious and worried and not sure what it's going to look like, and I get it. Right. And but we're going to move forward, and we'll try to be as sensitive to your concerns as we can, and that you encourage kids to voice what their feelings are. I always tell parents, just because you're eliciting feelings from your children, and it doesn't hurt to hear them out.
Right.
That you can just listen, and to be a good listener and to be able to reflect back, this is what I hear you're saying, and I'm sorry that you're upset, or it's unfortunate that you feel this way, and we'll try to make it as good an experience as we can. But to really just be able to tolerate hearing when kids are not happy about something.
So some people have this tendency to just kind of ignore problems. I find that with my clients, and I think that, in this particular case, I want to ask you, some people think time will just heal all wounds, and over time everybody will adjust, but they don't actually do anything proactive. And we know from the stats that only 30% of second marriages actually succeed. So my opinion, I want to know if that's yours too, is that really it's not a time to ignore a problem, but really you have to step it up and be proactive here.
Absolutely. And again, part of being proactive is just eliciting and having these ongoing conversations about what life is going to be like and what the changes are going to be like, and hearing kids' voices about what concerns them. And a lot of times being proactive is giving children the opportunity to talk to somebody outside the family that's a neutral, non-biased, non-partisan person, to be able to share, this is really hard, this doesn't feel good, or I'm really angry that Dad is getting remarried. And that's where sometimes school counselors have a role.
Okay.
And a lot of times school counselors do run groups for children whose parents are separated or divorced, and that can often be an important opportunity to take for kids going through this. Or it may be just useful to speak to a mental health provider. And I know sometimes I see children not in intensive psychotherapy, but for more supportive counseling. And maybe they don't come in every week, but at least it's a place where they can talk about how they're feeling, and it can be very cathartic just to share, wow, this is really hard, or I'm really upset that this is going on, and to talk about how to maybe make it better, if they have any ways that they can communicate perhaps more effectively with their parents, or to do strategies using peers, teachers, mentors, other family members to help them move through the period.
Makes sense. So if somebody wanted to contact you for further information, how would they do that?
Probably the easiest is to go to my website, which is my name, AndreaLeimanPhD.com.
Okay.
And that has links to emailing me if they want to contact me directly.
Perfect. Well, thank you so much. This has been great.
Well, thank you for having me.
Absolutely. Well, thank you for tuning in, and we'll see you next week on Making It Last.